Hey everybody, it's Dr. David with another Ask Dr. David video. I've been asked as to whether marijuana is safe to use during pregnancy. So this, of course, is a topic that comes up every now and then with patients of ours who are certified in the state registry. They're not allowed to use medical cannabis. We have to turn off their ability to access THC if we are notified during that they are pregnant during their certification, and we are not allowed to certify them for it if they tell us that they're pregnant at the certification. But that doesn't necessarily answer the question. But the long and the short of it is no. Okay. But let's still dive a little deeper into this because I know that this is something that women have certainly used through the ages, especially when it comes to the nauseousness that are associated with the first trimester. And I know people who have used it and who have been successful with it, whether it did have an impact on their child or not. I'll leave that to other people to figure out. But I did want to at least share the information that I was able to find from so that you have the best information possible. So, as always, any of the facts that I'm going to be quoting are listed down in the notes down below. So please feel free to look at the documents there. Everything is well referenced. Okay, so first of all, in terms of miscarriages itself, there is no human data that actually shows that miscarriages are associated with with cannabis. However, there are studies in animals that do show that there is a relationship there or an association. Now, in terms of developmental delays, there have been some studies that have been shown that can be developmental delays during pregnancy for both developmental as well as hyperactivity. But it's been more mixed when it comes to low birth weight, when it comes to premature birth. Now, those are things that are associated with smoking in general. And this is something that when back in the 90s, when I was at Tampa General, I did see some babies who were incredibly low birth weight when they were exposed to cigarette smoke. Now, granted, when a person is smoking a pack or two a day is much more of an exposure to those carcinogens and etc. than when a person is in cannabis, but certainly that would be something that I would be quite concerned about as well. Now, stillbirth. That's something that we don't hear too much about, but the risk factor for is 2.5, 2.3 actually times more likely to have a stillborn in a mother who's chronically using cannabis. And then also there has been some information regarding developmental delays overall. So it's, things such as altered visual stimuli, high pitched cry, which is something that we learn first off in pediatrics. Whenever you hear a newborn with a high pitched cry, that's always a sign of a potential neurological condition as well. Increased trembling in these babies as well, almost kind of like a fetal alcohol syndrome kind of symptoms that these babies can be having. Now, they've also done some research on school age children of mothers who used when they were during their pregnancy, and they have shown that there have been issues with skills, memory skills, problem skills, inattentiveness, etc. So certainly not a lot of good news there. Probably not too surprising to anybody out there. Similar to other recreational drugs, that this could potentially be an issue. Certainly, if people are using cannabis for that reason, there are lots of other reasons for ways of treating the nausea of pregnancy. Things like the C bands that are used for when people do boating; those could be very helpful with those acupuncture points it hits. Pardon me. It could ginger tea, mint tea, they can be very helpful as well. Vitamin B6 with magnesium can be very well. Staying as hydrated as possible. I know when you're nauseous, it's sometimes difficult as well. Different types of herbal teas, essential oils. So there are other options if you have to use Zofran. That's something else. But really, I would not be advising the use of medical cannabis during pregnancy. Have a nice day.